Hi, this is Katie with Alpine Rescue Team. Today we're going to be demonstrating the trauma assessment in the unresponsive victim. This is Sabrina, our victim, who's fallen approximately 60 feet while climbing in the pit. First thing I'm going to do before I approach the scene is survey the scene for safety to make sure there are no threats to me or my partner Zach, and I've gone ahead and put on my BSI. Now I'm going to go ahead and approach the victim. I'm checking her for responsiveness. Sabrina! Sabrina! And I get no response to pain. I'm going to check her airway. Because there is no response to pain and she's unresponsive and she's not conscious, I'm going to go ahead and assume that I have permission to treat her. First thing I'm going to do is listen, see if her airway is open. I don't hear, see, or feel any breathing. Hey Zach, can you come hold C-spine for me and open her airway? At the same time, I'm going to check a quick carotid pulse, and there's a strong pulse present. Because of her mechanism of injury, we're going to assume that there's a need to hold her C-spine. So go ahead and straighten her head a little bit, and we're going to open her airway with a jaw thrust. And with that jaw thrust, I now feel breathing, I see chest rise and fall, and I feel breath on my cheek. Her respiration rate is adequate, and she is breathing deep enough that I'm comfortable I can keep on going with my assessment. So we know that she has airway has been addressed. I don't see any major bleeding or obvious life threats that need to be addressed right now. We've determined that she's unresponsive. At this point in my primary assessment, I'm going to determine that we need to make her a rapid evacuation, an emergent evacuation, and request additional resources to make that happen. Based on her mechanism of injury, we're going to continue to hold her C-spine, and I'm going to ask Zach to monitor her airway as I proceed into my secondary assessment. With the secondary assessment, we're going to start at the head, work our way down the body, and check for signs of injury. And I'm going to check her head. As I'm feeling the back of her head, I feel some instability. When I pull my gloves up, I see a little bit of blood. I'm going to go ahead and take a look at her eyes to see that her pupils react, and they both react briskly. I'm going to feel the facial bones, look in the nose and the ears for any fluids, and I do see clear fluid coming out of both. No vomitus or anything in the mouth that needs to be addressed right now. I'm going to check the neck for stability. We did already check a carotid pulse. I'm going to check her arms quickly for any signs of obvious injury. I'm going to check a radial pulse here and here. I'm going to check the chest wall for any instability or signs of injury in the sternum. Because she is breathing adequately, I'm going to take a quick listen to her lungs. And then continue to proceed my way down the body. I'm going to feel her abdomen, check for any injuries that I can see, check the pelvis for stability, and I'm going to assess her as she lies initially for injuries. And I would undo her boot and check for pulse. I'm just going to slowly start to unwind her as I do my assessment. Again, feel for a pulse here in the foot. Go ahead and straighten out her legs. Next, we're going to need to check her back. Zach, you're in charge of the head, so we're going to roll her toward me. And when you're ready to do that and I'm in position, let me know.
On 3, 1, 2, 3.
And while maintaining her body in a straight line, I'm going to check her back, work my way down her spine. Again, still looking for any obvious bleeding or life threats. I'm going to take a look at her back, and I don't see anything back there. Just because I had that blood and instability up here, I do see quite a bit of bleeding and feel a little bit of instability in the back of her head. So we're going to go ahead and roll her back on 3, whenever you're ready, Zach.
1, 2, 3.
At this point, then we would go ahead and prepare her for transport and get a full set of vital signs. And since we've already requested an evacuation, we would proceed with vital signs and maintaining C-spine immobilization and monitoring her airway. And that is your primary and secondary trauma assessment on an unresponsive victim. What did I miss?